Have you ever noticed a painful bump down there that just won't disappear? You're not alone. It could be a wart or herpes, but it might just be an ingrown vulval hair. How can you tell? When should you worry? And why won't this lump just go away? According to a Metro report in March 2023, around 71% of young people under the age of 25 shaved the hair around their private area. The numbers were about equal for both sexes, and the reasons given for doing so were quite varied. For example, religion, when they're just about to see a doctor or other healthcare practitioner, just the preference for a neater or cleaner look down below, for getting relief or discomfort, or as a preference before having oral sex. If you shave, trim or wax your genital hair and you feel comfortable doing so, let me know in the comment section why you choose to do so. And if you're among the 30% of people who don't, I'd also love to know your reasons. Well, speaking about reasons, years ago, shaving hair before some types of surgery used to be the usual or routine practice. For example, before a woman has a cesarean section. However, shaving is no longer recommended. According to this NHS guidance, do not shave your pubic hair before your cesarean section, as this can increase the risk of developing a wound infection. The midwife may remove some hair using clippers immediately before your surgery. Sexual health services also recommend not shaving genital or pubic hair, with advice from NHS sexual clinics telling us pubic hair is there for a reason. It protects our genitals from external irritants such as dirt and bacteria, much like the role of the hair on our heads, our eyelashes and eyebrows. Shaving and hair removal products cause damage to sensitive genital skin, causing irritation and localized infections such as folliculitis. It can also leave us more prone to outbreaks of genital warts and herpes simplex virus (HSV). Our skin is our first defense, and if it is inflamed or broken, it provides a portal of entry, allowing these viruses to spread around the area. Ingrown vulval hair, also known as ingrown pubic hair, is hair that grows back in the wrong direction. That is, it goes back into the skin instead of out after shaving, cutting, plucking, waxing, and so on. In other words, an ingrown vulval hair is hair underneath the skin around your vulva, which leads to a painful lump or bump in that area. While ingrown pubic hairs are not the most severe health condition you can experience, they're extremely common. They can also get quite painful and uncomfortable, and in a few cases a bit tricky to get rid of. Ingrown vulval hair is most likely to happen when the vulval hair is cut, trimmed or shaved or plucked. But why and who is most likely to be affected? Well, first, your type of hair. People with thin hair are less likely to develop an ingrown vulval hair than those with coarse, curly or thicker hair. And the reason is, I think, obvious. This is because curly, thicker hair is more likely to fold and curl back on itself and lie folded underneath the skin instead of going up and out as it should. However, before you think it's only as a result of hair type, hold up. Tight-fitting or close-fitting clothing can increase your risk of developing vulval ingrown hair, thanks to the friction of the material constantly rubbing against your hair and skin. Using a dull blade, razor or trimmer during your shave is also more likely to ensure that the hair does not grow back correctly. The next reason is the way that you trim or shave. If you keep getting ingrown vulval hairs, you've probably been shaving it all wrong. So yes, if you shave against the direction of your hair growth, you're more likely to develop lumps and bumps in that area from ingrown hairs. Ingrown hair can look like raised, very dark or red bumps on the skin of your vulva, depending on your skin tone. Clearly on dark or brown skin, the bumps will look darker. Generally, ingrown hair can be very itchy. Sometimes they may appear quite swollen or more swollen than originally, and filled with pus. And so it might be difficult to differentiate an ingrown vulval hair from something like a vulval cyst or folliculitis in that same area. Now, most ingrown pubic or vulval hairs can be treated at home unless they become infected, when you will need treatment with antibiotics. An infected ingrown pubic hair is one that is getting more painful and swollen. The surrounding skin may look a lot more darker, more red, feel hot, and a lot more uncomfortable than when things first started. The best treatment for an ingrown pubic hair is not to have one in the first place. So, where possible, avoid shaving your pubic or genital hair. But if you do wish to shave or cut or trim or pluck or whatever, remember that there are quite a few of those risk factors that are actually within your control. So, employ proper shaving or trimming or cutting techniques. Wetting your skin with warm water before starting and using shaving gel. Shaving in the direction of hair growth. Using clean, fresh razors every time, or alternative hair removal methods like laser treatments. Check out these NHS recommended do's and don'ts for having healthy pubic hair if you wish to shave, trim, pluck, and so on. Wet your skin with warm water and use shaving gel. Shave in the direction the hairs are growing. Use as few strokes of the razor as possible. Rinse the razor after every stroke. Hold a cool, wet cloth to your skin after shaving to reduce irritation. Use an exfoliating scrub to help release any trapped hairs. Try a different hair removal method, such as hair removal cream. Try a long-term way of removing hair, such as laser treatment. And then don'ts. Do not shave too close to the skin. Leaving some stubble can stop bacteria from getting in. Do not use a blunt razor. Do not shave every day if possible. Do not scratch, pick, or squeeze ingrown hairs, as this can damage your skin and lead to infection. If you're treating an uninfected ingrown pubic hair at home, here are some steps to follow. First, use warm compresses. Apply a clean, warm, wet washcloth to the area for about 10 to 15 minutes and do that up to 4 times a day. This can help in softening the skin over the ingrown hair, making it easier to come out sooner. The next thing you could try is tweezing. If you can see part of the hair sticking out of your skin, carefully grasp it with clean tweezers and pull gently. Don't yank hard to avoid the hair breaking and the roots remaining trapped underneath the skin. And don't try breaking open or cutting your skin to remove the hair. Next, you can try scrubbing. Gently scrub the area with a clean, warm washcloth. This method can help to get rid of the top layer of skin or exfoliate to get the hair out. You should also stop shaving or waxing that area until that ingrown hair has disappeared. Ingrown hairs are usually harmless, but they can easily develop if you're not being careful about trimming or shaving your pubic hair. Repeat cutting, trimming, or waxing means repeat lumps in most cases. But if you keep getting them quite often and you're not sure, please speak to your doctor to check things out for you. Thanks for watching. Have a look at this playlist here for more helpful vaginal or vulval health guides, and I'll see you again soon. However, before you think ingrown hair will only happen because of your hair type, hold your hair.